Good morning. This video this morning is very different than anything I've posted before, which is generally banjo videos, me picking banjo. But I wanted to share with you an experience with a weird medical condition that has developed and what it's about and what I've done to deal with it. And this is not scripted, and I'll try and cut out any rambling. But about 2.5 months ago, I was biting into an ear of corn, and about the third bite, this canine tooth, from the tip of the tooth to the root, which is way up here near, near the eye socket, was like an electric lightning bolt hit. It was instantly 10 on the scale, put me on my knees for about 3 or 4 minutes. And I thought I'd broken a tooth. That's sure what it felt like. So I went to the dentist, who took a series of x-rays of this area, didn't see anything, took a 360-degree x-ray of my whole head, all the teeth, didn't see anything, took a 3D x-ray, examined it thoroughly, basically concluded that the teeth are fine, the gums fine, the bones fine, and there's no infection. And I also, at the same time, during this first week of this condition, I could be scratching my head and would, touching here, in fact it's doing it a little bit now, would fire the pain here, or I could touch my temple and fire it, it'd be in this area, or touch my eye. And they basically said, teeth don't do that, maybe you should see a doctor. So I did line up an appointment with, here in Spartanburg, St. Luke's Free Medical Clinic had accepted me as a patient, so I already had an appointment there lined up anyway, so I mentioned this condition, and the doctor immediately suspected trigeminal neuralgia, a term I've never heard before, and ordered a series of some CT scans. So they did the CT scans of my skull and the sinus area, and there was nothing there. Maybe a brain not to see either, but in any event, so there wasn't anything they could do. Called the doctor. The pain was getting more and more intense. It's like a lightning bolt. It would shift from a lightning bolt to a sizzle. It's very electrical in nature, always in this area, and it would fire either by touching it or spontaneously on its own, just out of the blue. When it started, it was a few times a day, and then as weeks progressed, it was more and more frequent and more intense. So all they could do was prescribe medication, which I refused. I'm just not going to go down that path unless I have to, in worst case scenario. So, but in the meantime, it was getting more and more intense to the point where it's almost unbearable. About 2.5 months in, I could barely eat, and again, it was inconsistent. Sometimes it would go away, give me a reprieve for an hour or so, but when it would hit like a hammer. I could be eating and every bite was just like excruciating. Anyway, it went on like that. So I finally called the doctor back and said, what was the name of that medication again? Let me just research it. And I researched it and decided again the side effects were simply not worth it. I would endure the pain, which was getting worse. And in the meantime, it occurred to me to try acupuncture. And the reason that occurred to me was there's some friends of mine up in Sugar Grove, North Carolina, and one of the friends is an administrator at the Young Dao School of Classical Chinese Medicine, where they teach acupuncture. It's a very respected school. And I had gone to the clinic maybe 6 or 8 years ago, maybe in 2012, 2013, for a condition. I don't remember what I was getting treatment for. I think it was a skin rash or something. And I remembered that during one of those sessions, they had a bunch of needles in my head and in my arms, and when they went to insert a needle, I think it was somewhere in my ankle or foot, they hit the wrong spot. It was like being electrocuted. I mean, I could actually visualize a blue arc of electricity in the instant. It was like, if you've ever seen electricity arc, it was exactly like that, and it felt like I was being electrocuted. Of course, she pulled the needle out immediately. She knew she had hit the wrong spot. And then, I kind of forgot about it until a few weeks ago, dealing with this pain. That memory came back. It's like, wait a minute, that's a very similar kind of pain to what's going on here. It's an electrical shock. Sometimes it's like a lightning bolt. Sometimes it's like sizzling, like putting a 9-volt battery to your tongue. If you've ever done that, you know what I'm talking about. If you haven't done that, give it a try. You'll see what I'm talking about. And it was way more intense than that. So I reached out to my friend who's the administrator at this school and described the condition and named it Trigeminal Neuralgia. And she checked with the main administrator, and the response I got back last week was, yes, they have experience treating this, and yes, we can definitely help. So I thought, well, what the heck, they have a student clinic. It's a 3-hour drive, so I arranged a series of 6 appointments. The first 2 appointments I just had this past weekend. Today is Monday, November 1st. So I had my first appointment Saturday at, I believe it was 3 o'clock, and that lasted 2 hours. And then the second appointment was yesterday at 9:30 in the morning. After going through the description of what I've been experiencing at the first appointment, they decided on their course of treatment, and of course it involved needles, at various points here in the head and in my feet and various other places in my body. But 2 of the needles here and here, they put an E-stim, electrical stimulation, to it, which helped. But after the first appointment, which I was out of there at about 5, I stayed at a friend of mine's in Boone, North Carolina that night. I noticed that even when it would flare up, it was still as intense as it was before, but the frequency and the duration had been ratcheted down several notches. That was noticeable. And I mentioned that the next morning. So at the next morning, which was yesterday, I asked also that they put the E-stim on this spot, which there was a spot here where I could touch. In fact, it's doing it a little bit right now, where we're just immediately like pushing an on button. And other spots like here would do the same thing. Touching my eye would flare it up, sometimes my eyelash. So I asked that they put E-stim here and in my temple as well, since those were the 2 main on buttons. So they did electrical stimulation on those 2 needles, and again on these 2 needles, and then he had other needles at various points. And again, after the second appointment, I again noticed a ratcheting down of duration and frequency. In other words, it didn't occur as often, and when it did, it didn't last very long. So after the second, but when it hit, it was still as intense, just not as long. So I noticed driving home yesterday afternoon that the whole trip home I had maybe 2 flare-ups, which on the drive up it was flaring up constantly. At its worst, it would flare up 5 times a minute. It's flaring up right now, just touching my face, but it's gone, okay? But right now it's nowhere near as intense. So since yesterday, when I got home maybe about 3 in the afternoon till now, which is about 10 in the morning on Monday, I've had only a few flare-ups. When they hit, now the intensity is less, the duration is less, and they're less frequent. So I would say about 90% ratcheted down compared to what it was last week, which is remarkable to me. I've got 4 more sessions lined up, 2 next weekend and 2 the following weekend, and I will post a video on how that goes. But I had considered posting a video last week before I took sessions, because at that point I could fire it up and it was extremely painful. I could touch here, and it would just fire off, and to the point where I'd have to stop talking or eating or whatever I'm doing. Just then it fired off just for a second. It's like right there, I felt it gone, hit and miss, hit and gone. Because I'm moving my mouth and talking, fires it up. But it's way, way better than what it was. So I'm not suggesting anything to anyone about this condition. If you research trigeminal neuralgia, basically the doctors don't know squat. There's all these theories out there. They think it's the trigeminal nerve at the C5 vertebra degrades and is touching a blood vessel, which sends a signal of pain. That makes no sense. That's freaking stupid when you think about it. There's a theory that it's not really a pain signal, that the pain is a tricked signal to the brain. You think you're feeling pain. That's BS. It's pain. evidenced by the fact that the worst case scenario treatment that Western medicine can come up with is to sever the trigeminal nerve where it comes out of the C5 vertebra. It basically comes up here and splits off into 3 directions. So if severing the nerve stops the pain, then the nerve is carrying a signal of pain. It's just that simple, you know. The only therapy that they could offer was medication. I looked up the one they wanted to prescribe to me. It was about 5th on the list of prescription treatments. All of them that I could see were anti-seizure medicines that were not intended for pain. Pain was just, alleviating pain is just one of the side benefits of the pill. So in any event, that's my experience with it thus far. I'd never even heard of this until two and a half months ago. It's been quite an ordeal because when it flares up, boy, does it get your attention. I was at a jam session a week ago, I think it was a week ago Saturday, an hour and 20 minutes from here, and as soon as I got out of my van with my banjo case, it immediately started flaring up. I don't know why, movement or excitement or whatever, but it was unrelenting all night. It was hitting about 5 times a minute to the point I was just like, you know, this really hurt, but I could still function. It's just flared up just then, gone. But anyway, it was pretty intense, and that, you know, it was stupid, ridiculous, goofy, intense. So anyway, my experience with the course of therapy I've chosen has been positive so far. After 2 treatments of acupuncture, I would say it's reduced in about 90%. Maybe it's starting to come back. There's 4 more sessions, and I'll report back after the 4 sessions are over with what my experience is. This is a lifetime condition. There's no known cure. They don't know what causes it. There's various theories about maybe getting hit, you know, might be a triggering event. I do have a vague memory of this cluster of 3 teeth. My teeth are kind of messed up. I don't know if that shows up, but all the roots are jammed together. But I was hit, you know, in that area. I was working on my car and the tool slipped and hit me right there. That was like in April. That may have been a triggering event, I don't know. But for me, it was triggered when I was biting into that ear of corn. It just was instantaneous and put me on my knees. Anyway, I've rambled on long enough. This is, as I say, a very different video than I've posted in the past. But I thought it might be of interest. I'm not recommending therapies for anybody. You choose what's best for you, as I have for me. Thank you.